Hi everyone, it's a Friday and I'm out here on a trip with my daughter. And I just wanted to share something I commonly see in my clinic. And what is it? When is fever actually an emergency? It's one of the questions that I get as a pediatrician, and parents would ask, Doctor, when should I actually worry about a fever? Here is something that may surprise you. Fever in itself, it's not always an emergency. In fact, a fever is often the body's normal response to fighting an infection. A true fever is if your child's temperature is 100.4 or greater than that. It's important to know this so you do not overmedicate your child or panic without reason. As pediatricians, we're not just looking at the number on the thermometer, we're looking at your child. And we're also asking an important question. What's actually causing this fever? Because the fever itself, it's a symptom. The real question is the underlying cause, or what we call the etiology of the fever. We're looking at things like, is your child drinking fluids? Are they breathing comfortably? Are they responding to you? Are they playful between fever episodes? Are there signs pointing to something more serious? Now, there are situations where a fever should be evaluated promptly. If your child is difficult to arouse, it's having trouble breathing, is showing signs of dehydration, it's having a seizure, or if your child is younger than 3 months old and has a fever. Those are situations where you should seek medical attention urgently. And honestly, I've found that, this is also something that applies beyond medicine. In pediatrics, we are trained to look beyond the symptom and look for what's happening underneath. And I think it's also very true about life. Many people focus on today's paycheck, today's challenges, today's obstacles without looking at the bigger picture of where they are headed. So I want you to remember this. Don't just panic because of the fever alone. Pay attention to your child. Look at the symptom and other symptoms. And when you're in doubt, call your child's pediatrician. Okay? Take care, and I hope you have a good weekend and a good rest of your evening and your day. Okay? Bye. Bye.